it. So everybody in here knows me, I think. I'm Tony Rich, for those that don't. Anyway, this is, I didn't know what else to call it, so a primer and exercise evaluation sounded good to me. This is a course that if you were to take it through the Emergency Management Institute as part of the Master Exercise Practitioner program is 4 days long. And there's a lot to evaluation. And Sarah and I were bantering back and forth before class started. I think that my focus today is a lot of us have been asking historically to evaluate an exercise, and we go in and they say, we want you to evaluate the opening of the command center. And how many have ever done that, but nobody's ever given you an objective, giving you any documents, giving you anything to look at to say, this is what we want to measure, this is what we want to test, this is how we want to, this is what we want to capture. And that happens a lot. And if that happens, we don't get anything out of it. We don't have...
Sorry, I'm late.
You're excused. So we just, it doesn't do us any good. And so I just wanted to put together a few things that will help us, because we have a lot of exercises coming up. And one of the things that's happened is we've lost almost all of our grant money from the Assistant Secretary of Preparedness and Response from ASPR. We get almost nothing. So we're asking all the facilities and all the agencies in the region to pony up, and we're going to start doing our own exercises without federal funding, our own evaluations. But we want to make sure we give some people or those that are interested the tools to be at least a decent evaluator, and you'll gain as you go. And some of this stuff is for, how many's been evaluators for years, more than 5 years? You know, some of this stuff is intuitive to some of us. But I want to try to break it down to what would be expected from an evaluator, and what should an evaluator expect from the people that are creating or designing the exercise. So according to HC, Homeland Security Exercise Evaluation Program, and exercise objectives are the cornerstone of the exercise design and development. That is true. And if the objectives are the cornerstone, then I think the evaluation is the body of the exercise. Because without an accurate evaluation, you cannot create an after-action report or a performance improvement plan. And those are things that we have not done well historically in healthcare, because we've not had good objectives and good evaluators. So exercise objectives define specific goals. Operative word there is specific. Provide a framework for scenario development and guide the development of individual objectives, and supply exercise evaluation criteria. If the objectives are not, boy, I screwed that up, are not clearly defined, if they don't define what's to be accomplished in the exercise, there's no sound basis for the evaluation. And we're going to demonstrate that in a moment. If the evaluator does not know what the identified process and standards are, it's extremely difficult to gain insight into any areas that may not perform as desired or those that may exceed expectations. So, it's incumbent upon whoever designs the exercise to be able to identify a process and provide the evaluator with the standards that are to be used to evaluate against. Because we don't do things the same in all of our facilities. We don't do things the same in all of our regions, or in all of our markets, or in all of our ambulance companies, or in all of our fire departments. We just don't do things the same. So if we go into that and we don't have very, very clear objectives of what's to be expected, what the standard is, and what's to be measured, then we're left no choice but to be subjective in our evaluation. And that does us absolutely no good. Because then we're entering ourselves into the exercise, and this is what we do. And there's no room for that. This has to be by objective. Objectives. They have to be specific to the capability and area that's going to be tested. They cannot be general. I'm going to give some examples here in just a minute. They have to be measurable. The wording provides a basis for the evaluator and can be observed during the exercise. I think measurable, the best way to measure events or criteria or exercises or actions is through identifiable metrics, and time is usually one of those. how long did it take to do something. In the objective, it can identify how long it is expected or anticipated that it will take. And that has to be identified, and then we can measure against that and see how long it really took. That makes it measurable. People are measurable. Processes are measurable. All those things we can measure against as long as we know what the beginning standard is. Does that make sense? Attainable. The desired decisions, activities, and tasks required in the exercise. Now, I'm going to stretch this out just a little bit, but attainable. We don't want people to walk away feeling like they got beat up and didn't know what they were doing. It has to be something, all of our objectives has to be based on current processes or plans so that people know what the expectations are and they can attain that. We have certain attainable goals, don't you, Phil, in trauma program. We under triage, over triage, we have to make those attainable. We clearly identify what the norm is or what the N is, and then we can go from there, and it makes it attainable. Realistic must be related to an actual existing capability. Now, I don't know about y'all, but I've been doing this an awful long time, and I've been invited to drills, and hi, Sam.
Good morning.
I've been invited to drills and exercises where I was in Fargo, North Dakota, and they got a football stadium, and they were going to have a jet with biological infectious agents on the jet crash into the football stadium with a 20-mile-an-hour wind, and it was going to blow across town. The fire department was going to respond and get stuck in the mud. Realistic? Absolutely not. Absolutely not. But we're having a drill here on June 25, and we're having 25 patients come into the ED over a period of about an hour or 90 minutes. Is that realistic? Mm-hmm. Is it realistic that many of them or most of them might be surgical patients? Mm-hmm. And they would all have to go to the operating room? That's exactly what we're going to do. And then we're going to push them out to the floors, but we're going to make it realistic. And then task-oriented. The evaluator will clearly understand and be guided to look for the activities undertaken to satisfy the objective. So, did it get accomplished? Did the specific task meet the specific objective? So that gives us SMART objectives, and that's what we live by when we design exercises. We live by SMART, or we should. And that doesn't happen all the time. So here hi Travis. So from here on, and Sarah and Daryl, you guys feel free to jump in anytime. You guys are the pilot class for this. You're the guinea pigs. And this is something we're going to keep doing on and on, but we know we're going to need to tweak this. But remember SMART objectives. So if you are an evaluator and you're asked to evaluate an exercise, I think part of your responsibility is to challenge the exercise designer and look at the objectives and see if they are SMART, now that you know what those are. And if they're not, then the exercise designer or the evaluator team leader needs to be challenged or questioned about the specifics of the objectives. Otherwise, we can't do a fair job. Is that a SMART objective? If I want somebody in the command center, and you're going to evaluate the command center, is that a SMART objective?
No.
Why not?
It's too big.
It is too big. Open the command center with what? A can opener? Prop the door open? I don't know. What? That is too big. How about establishing incident command? Is that any better?
You mean a person?
What is it? Incident command is a process. So it's still not a good objective. I've seen it. This came right off objectives I've seen. How about this? Establish incident command within 5 to 10 minutes.
Not realistic.
Pardon me?
Nothing is realistic within 5 to 10 minutes.
I would agree. It is better, but it's still not realistic. Anybody work in a hospital ever seen a command center open in 5 to 10 minutes?
You have to find it in 5 to 10 minutes. I mean, I know where it is, but
You're exactly right.
if it's somebody who hasn't seen it lately, they might forget where it is.
If you're busy, you can't get there in 5 to 10
Right.
minutes. That is exactly right. How about in a community? You ever see a community? We don't open the command center in Mecklenburg County, but if we did, how long is it going to take? Sure, not 5 to 10 minutes. Assure that the incident command is established. Oh, now we're getting a little more specific. assure that incident command is established. And that's a bit better. We can say, well, we have to assure that there's an incident commander and that the command process is identified. Still not quite there. How about this? Establish incident command in less than 30 minutes. Is that a smart objective?
A little better.
Yeah, it's smarter, but I think it can be better yet. So to make it really able to be evaluated, how about establish incident command and identify incident commander in less than 30 minutes? Now that is a specific objective. That says that I'm going to have somebody come in, they're going to be identified as the incident commander, and they're going to begin to lead the process. I think that's measurable in less than 30 minutes. I'm going to document the time that it took to do that, and did it meet the expectation? Did it meet the standard, or did it fail? And that's what we're going to do as evaluators. No subjectivity at all. It's just based on what we see and the time. With me so far? So how many objectives should you expect to see? If you're an evaluator and you walk into a drill or an exercise, how many objectives should there be?
Hopefully only a couple.
Hopefully.
3 and 5.
I'm doing a drill in Oklahoma in September, on September 11th, ironically, and they sent me their objectives. They have 27 objectives. And I sent it back and says, I can't do it. Why? What's the problem with too many objectives like that?
Splitting your focus.
You're too fragmented, maybe.
You're too fragmented, it splits your focus, it breaks your focus, what else? Can we act?
Each of those are going to have more findings in them.
That's exactly right. You know, it's that old thing, you find one thing to do and then you find 6 more after that. And objectives are the same way. If you have one objective, you'll find other things within that objective that need to be addressed. What else?
You can't focus on that many things at one time. You will become overwhelmed very quickly just in the ED looking at the surge if you've got to look at everything.
That's
If
right.
you're only looking at how you're receiving patients from EMS, that's all you focus on. Whatever else goes on is not your problem.
That's exactly right. You know, one of the things we'll be evaluating is our rapid registration process. Will we be able to register every patient that arrives in less than 3 minutes? That's the goal. That's measurable. But if I have somebody else looking to say, do they all get placed in rooms? And is there a physician at the bedside? What time does the nurse arrive at the bedside? What time is the assessment done? That's too much to watch. And we don't learn anything from it. And then even if you could evaluate them, do you think that in an after-action report, all of those things are going to reflect a performance improvement plan?
You set yourself up for failure.
You absolutely do. And then as an evaluator, I'm walking away from there saying, geez, I wonder if I got everything. And that's not fair to us as evaluators. So it depends on how many objectives you have. I'm a big fan of having 3 or less. I really like 3 or less, as long as they're very specific. And I think the thing to expect is that when people write exercises, exercise designers and planners write exercises, they want to try to accomplish a lot in one exercise. And you've got to understand that this is a very timely process. You know, I think if you write a 5-year plan, that's very difficult to develop a 3 to 5 year exercise plan for a hospital. But it can be done, and we're starting to do that here. We're 3 years into our planning process here, and this will be the first time we've ever sent patients to another department other than the emergency department in a drill. And I think that's reasonable, because we had a lot of things to learn about the emergency department, and call trees, and phones, and registration. We spent 3 years honing those processes. I had one of my counterparts from another healthcare organization called me. He says, well, aren't you doing any clinical evaluation in your exercise? I said, no, we can take care of patients. We got to define the process. We got to tweak the process to get them where they can be taken care of. And I think that's the bigger issue. Surge capacity and influx of patients, very difficult to evaluate in a live, working, active hospital. Our surge plan says that we can surge to 10% above our current census in 4 hours. That's a pretty tall order. That means today I have to be able to come up with 39 beds in the next 4 hours. Can we do that? I think we can. Some people will say, well, no, you can't have all the supplies on the floor and you can't have all the pharmacy on the floor. I don't need those things. I need to be able to put a butt in a bed and have somebody watch them. Because over the course of the next 4 hours, I can get the logistics. I can get the pharmaceuticals. I can get the supplies. I don't need those to put a butt in a bed. So that's what we're going to do, is evaluate. And then how many patients could be discharged in the next 4 hours? Because that's going to be key to that. So we're going to try and find out. But those are very, very measurable objectives. So exercise evaluation, that's all I'm going to say about objectives. That's a whole nother 4-day course on objectives. The process of observing and recording the exercise activities, comparing the performance of the participants against the objectives. Again, the importance of the objectives being specific, and identifying strengths and weaknesses. Or if you prefer, strengths and opportunities for improvement, to be PC. Good evaluations can identify whether the exercise has achieved its objectives. And in the back of your packet, there are several forms that I've put in there that came from a site. And I'd give you an example of the different types of forms we can use to document our evaluation of the exercise. Some folks use met or not met. Some folks use a range of 1 to 5. Some use, there are different methodologies, but what's important is the notes that you keep after you mark the numerical value. If it's met, then tell me why it was met or how it was met. If it was not met, again, why or how it was not met. If it's a scale of 1 to 4, then explain why it got a 4 and not a 5. Explain why it got a 4 and not a 3. But put that in your narrative so that it's understood. Needed improvements in standard emergency procedures and guidelines. You know, for you hospital people, the Joint Commission says that our emergency operation plans should be evaluated after every drill or exercise. How many hospitals do you think really do that? Very, very few. Do you, Robbie?
Sure.
I don't. Or real events. We had 14 real events, drills, or exercises last year.
Yeah, it's hard to evaluate the entire EOT after every, I mean, we pick pieces.
You pick, that's exactly right. And which pieces do you pick? My fire chief once told me, I says, Chief, there are so many regulations and so many requirements. There's OSHA and there's NFPA and there's all these things. I says, how do you know which ones to pay attention to? He says, I pay attention to the ones that are most likely to send me to jail. Well, and he's right. We do the same thing. We pick the ones that are most likely to be asked about by the Joint Commission. Is that fair? Not really. Not really. We should evaluate the entire emergency operations plan based on what we've learned. Sometimes we just have to pick and choose. Training and staffing deficiencies. A good evaluation can identify training and staffing deficiencies. Absolutely. I'm going to tell you, there's not much we can do about staffing deficiencies. Not in healthcare anymore. We have what we have, and we have to make it work. So that means our training has to be more effective. I think there are a couple things with that. I was asked in a corporate meeting for emergency management. I was going around the table, and the question was asked, what do you think our greatest liability is in emergency management? Any ideas, anybody? What would our greatest liability be in emergency management?
I would say not following your policies and procedure that you've got in place.
Okay, and that was mentioned. I said I think our greatest liability is staff training and education. I think we don't do enough staff training and education. That, I think, is our greatest liability. Because you got to count on people to do the job. They have to know the policies and procedures, and now CMS even comes out with 486 pages, one of which says that every employee must be educated to the emergency operations plan. Not provided a link, not given a website, but must be educated to the emergency operations plan. That's a pretty tall order.
Expensive, too.
It can be. And I'll tell you, one of the things we satisfied with the flip charts.
Yeah.
because our flip charts have excerpts from all the, from the EOP, and if our staff are educated to that, then we've done that job. But man, that training is tough. And then training people outside their job description. Now we're training people to be incident commanders. Now we're training people to be medical branch directors. Now we're training people to be operations section chiefs and planning section chiefs and logistics chiefs. And that's all outside the scope of their normal responsibility. So finding the right people to train is a whole nother issue, or the people that are willing to be trained without being voluntold. Needed operational equipment. I'll tell you what, if you conduct an exercise in a command center, that's how we got the stuff at Huntersville. Kathy did an outstanding job, Kathy Bonds with Huntersville, because we identified through exercises what we didn't have, or what we needed, as far as needed copy machines, needed vests, needed pens, pencils, erasers, scotch tape, staplers. All those things count. You know, we think about the big things. Well, I need a smart board so that I can save all my information. No, you don't. You might need a dry erase board with some, and my pet peeve is going into a classroom that's got a dry erase board with old markers that don't write. You know, I hate it. I used to carry my own. But that's a very valuable resource. That's something we can learn through good evaluation.
And now we really don't need smart boards because everyone has 40 cell phones or some way to take a photo.
You're right.
That they're just not useful anymore. You take a picture, then everybody gets it.
You know, we have a smart board and it'll save everything to a jump drive, then you can erase it. But that before smart boards, that's what we did. We just take a picture right on the board, take a digital picture of it, save it to file, and you've got all your documentation. There's lots of creative ways around stuff. And then the need for continued exercising of the plan in the emergency management functions. Through good, accurate, appropriate evaluation, how you evaluate and what you write in your narrative will indicate whether additional training or exercise is needed and where it needs to be focused. The purpose of the evaluation is to evaluate performance on critical tasks. Those critical tasks present themselves as emergency exercise evaluation guides. And I'm not going to get into a whole lot of detail, but exercise evaluation guides identify critical tasks or capabilities. Rattle off some, Sarah, can you?
I'm sorry, I was taking a note, so I didn't forget to ask you something later. What was the? What was your question?
Identify name some capabilities. There's a list of like 50 of them.
Yeah, I mean, the capabilities that we're actually doing specifically for this exercise, we're actually doing it differently and writing our own. And or are you talking about the Gasper capabilities?
It doesn't matter.
Okay. It's one of them is to be able to activate for the emergency department when they know patients are coming in to activate their portion of the EOP and the incident command within 15 minutes. I think it's the time frame we put on it. And that was one of the capabilities. And then as far as the ASPR, which are the federal capabilities, they do very broad ones like fatality management, but then it would be far more specific. How do you receive families, patients and families, and reunify them with fatalities that you've received?
And then you can write more specific objectives underneath your exercise evaluation guide, and it gives you a good tool. You can go online and find hundreds of capabilities. The federal government published a list of 52 or 53 a couple years ago, so the stuff's available. Validate strengths and identify areas for improvement. Absolutely, you've got to tell people what they did well. And we always start out telling them what they did well. And then we have to identify areas for improvement. And again, this improvement is not based on our subjective opinion on how they conducted themselves. It's based on an objective assessment based on the objective. So did it meet the plan? If you go into evaluate a drill or an exercise, you should be provided certain documentation. And one of the things you should receive as an evaluator is a copy of the emergency operations plan or the plan for the exercise or some other things we're going to talk about in just a minute. But you should have that so you can reference it to see if they met the plan. And then
Who provides that? I mean,
When we conduct exercise, when we write a drill, when we create an exercise, there should be someone, a team leader, or an evaluation team leader that is responsible for identifying what the evaluation will be. And that's the person that should provide it.
And in theory, when you're solicited and you receive all your paperwork, the plan should be in there, but to send the entire EOP may be too much. So it may be just the piece you're evaluating.
Right.
I've evaluated, I don't know how many exercises. I have never seen a plan. I have been given this rubber stamped EEG and without any plan attached. So they may have done what I thought looked right, but if it didn't match their plan, then it was wrong.
And I've actually cut and pasted excerpts from the plan that were specific to that capability, to that objective. So they could see the language, and this is what the expectation is.
That's how our contingency plan for NASCAR events. I mean, you get a booklet. And I know you're talking about funding. The funding is going away, but you know, they give you a booklet and identifies everybody. I mean, there's some of these folks in here, I don't know what their roles are. You know, kind of new man on totem pole here, but that's how it is out at the NASCAR event. You've got so many people.
Sure.
You've got no clue what their job is, so you're coming in trying to evaluate something, and they slide that plan in front of you, so it's pretty easy to
You bet.
get there and pick them up.
The methodology for evaluation is to plan and organize the evaluation. Ideally, this should take place well before the day of the exercise. This is not something, and I evaluated an exercise in Thomasville last year, and we got the plan and the evaluation forms 15 minutes after the exercise started from the contractor.
Draft communication with EG, I just happened to have a copy.
Okay.
In case you needed it.
But plan and organize the evaluation. As an evaluator, you should be notified or receive information well ahead of the exercise. I say well ahead. It might be the day before, but that still beats 15 minutes after the exercise begins. It still gives you time to reflect on it and review it and see what the plan is. Regrettably, that doesn't happen a lot. So by telling you this, for those in here that will create exercises, I'm putting onus on you too, because as we move forward, that's part of the obligation. Part of design and objectives development, it is. It's a process. When we design and create our objectives, planning the evaluation is absolutely got to be part of that process. It's not something you do as an afterthought or you sit down and do 2 days before the exercise. It has to be part of the overall process. Determine what, who, and how it will be collected. So what information are we going to obtain? Who's going to collect it? Who's going to obtain it? And how will it be collected? And there are a lot of ways to collect information. And we're going to talk about some of them that are possible here in a couple minutes. While the exercise is being designed, the evaluation planning team will provide via the exercise plan, or the X plan if you've never heard it described that way, the master scenario events list, or the MESL. That is a series of injects that identify what the master controller is going to inject into the exercise at prescribed times to pre-identify positions or people for actions to take place. And that it's really cool to write injects and then watch it come together, but you should have a copy of those injects or that MESL so that you can compare the timeline in the event to what you're actually seeing and evaluating and make sure that that objective then is met by their response to the inject from the MESL. Make sense? Okay. Other exercise documents, you should have a copy of the goals and objectives for the exercise. It's not unfair to you as an evaluator if you don't have a copy of the objectives. You should have been identified how the exercise flow is going to go. And maybe that can be timed out on a piece of paper as a timeline that says that in this time frame this is what the expectation is, in this time frame this is what the expectation is, so that you know what the intent is, what the time period is for the exercise. I've seen lots of exercises that are supposed to go 2 hours and end up going 4. And man, that'll frustrate people to no end because it wasn't clearly